So, welcome to this episode of Mansag podcast. I'm your host and editor of the Mansag newsletter, Agbo. I have Dr. Agbo with me today. He's the president of Mansag. This year's annual Mansag conference is holding in Croydon from October 27th to 28th of 2023. Dr. Agbo has agreed to chat to me about the conference and what attendees can expect. Dr. Agbo, welcome.
Thank you very much, Jepla.
So, as you're aware, I'm doing this podcast to promote the upcoming conference, which I've just introduced. And usually I start by asking my guests to introduce themselves. So I hope you don't mind telling us a bit about yourself.
Please. Oh, that's fine. Yeah, thank you very much. I'm Chris Agbo. I'm the president of Medical Association of Nigerians across Great Britain from the 2021 to 2024 tenure. I've been a member of Mansag since 2009 and worked in the executive team as a financial secretary and secretary before taking the leadership of the association as the president. And then my workplace, I'm a consultant nephrologist with Northwestern Care Foundation Trust and honorary clinical lecturer with University of Hertfordshire School of Life and Medical Sciences. I did my primary medical education in Nigeria, University of Jos, my great Josites, and did my postgraduate training there. Subsequently went to Germany under the highly reputable German academic exchange program for 18 months subspecialty training in nephrology and intensive care nephrology. Subsequently came to the UK 2005, and I've been in the UK for this almost 18 years. Started my core medical training east of England, did my higher specialty training in renal medicine in Cambridge, east of England, Deanery. And I've been working as a consultant the NHS for the past 10 years. And I'm also involved in medical education with a special interest in simulation. I've completed a PhD in, and my research area is in acute kidney injury and medical simulation and immersive technology and learning. So that is where I am in terms of my clinical practice as a clinician in the NHS. I'm married with 2 children, a boy and a girl. They are grown up now. And it's been a pleasure, working with Mansag, both as a member. I started as a member when I was a registrar, and I've benefited a lot and getting to the level of leading Mansag. This great association is just a privilege for me to serve this large group of Nigerian healthcare professionals. And most rewarding is the fact that just last week or so, I was among the people that were awarded the 2023 top 100 most influential people of African descent in the world, which we got the award in New York on the 1st of October. And that is because my role as the president of Mansag. So I think that's something that is quite rewarding for each and every one of us as Mansag members. The award is actually dedicated for Mansag as an association, not just for me. I think I'll stop here for now, and then if you have anything else to ask me.
Well, thank you so much for that introduction, Grace, and thank you for the good job that you're doing for Mansag and raising our profile and advancing our cause. And at this point, what I really would like to say to our listeners is try and join Mansag, because within the organization we have very senior doctors, we have very senior experienced nurses, radiographers, we've got managers and leaders across the cadre of the NHS, and all of these people are willing to provide mentorship to our younger colleagues. So please do join Mansag, and we will do a separate podcast at some point on mentorship. But I just thought I'll just say that now. So, but thank you very much for that introduction. Now,
welcome.
Thank you. So the theme for this year's conference is transforming health outcomes, and we do have a line of very powerful speakers and interactive sessions with leading policymakers, clinicians, researchers, and healthcare managers. Now, could you, perhaps talk a little bit about why you chose this theme and what our attendees can expect to take home from the conference, please?
Yeah, thank you very much. This year's conference is a very unique conference in the sense that the content, the theme, and the presentation is so far is the best conference we expect to have in Mansag. And the theme for the conference is transforming health outcomes, and this is bringing up to the experiences we had during the pandemic and what we did experience both as healthcare professionals and as patients of ethnic minorities. And we do know that is evidently so that there's a lot of health inequalities, both as from healthcare professional level and the patient level within our Black community. And this is one of the things that we feel that we should be addressing this in a broader perspective. And the content of the conference in such a way that it cuts across different angles that we're addressing transforming health outcomes. So starting with training, as we can see that we have a lot of Royal College representatives. I think we have about 5 Royal College representatives, president and vice president of different Royal Colleges. And what we are trying to look into is actually engaging these stakeholders in a way of improving the training outcomes for our trainees, our members. We believe that once our members are well informed, are well trained, they'll be able to be part of the policymakers when it comes to research, inequality, equity in delivery of healthcare and all that. So that is one of the things that we are very keen on, and is also part of the vision for the association. So we're going to be having this highly distinguished representatives from the Royal Colleges discussing how they'll be engaging with Mansag to support our members in terms of training to change the differential attainment, which we do know that has been going on for a long time. At the same time, how they can also work with Mansag and transform some health inequalities, both the one that experiencing within, looking at actually collaborating with these Royal Colleges to see how they can support training of healthcare professionals back home. And that is one of the aspects for the conference, which I think I'm looking forward to that, because I think we have about 5 or 6 distinguished Royal College representatives that are very enthusiastic about this vision. And the other aspect is also health policy. So we have a number of high-powered speakers coming from both the UK and Nigeria that have been involved in different kind of health reforms and policy makers. So we're going to be discussing from that angle, the policy makers, how do we engage ourselves in a way that we can actually change the narrative in terms of the health inequality, improving the health outcomes among especially Black community. We're even narrowing it down now to Black community, not just Black ethnic minority, because we do know that Black community is still tagging lowest when it comes to health inequality and all that. So that's one of the things we are also looking at, inviting the various policymakers, both in Nigeria and in the UK, to discuss this and see how we can come up with a robust communique that we can work towards improving the health outcomes among our community, both in the UK and in Nigeria. And of course, we do have different aspects talking about regulation, how we can support our members in terms of, because we believe that if our members are well looked after, but they are coming from a unit which is a family, and if our members are impacted in one way or the other through some adversary impact of the regulatory bodies and are not well supported, that could also affect their family. So we're looking at how we can establish a very robust welfare system in our organization that we can reach out to our members. So we're getting involved. The BMA will be there, the Mansag welfare team, the NDUK, and these are the groups that we're looking at. How can we support our members? Because we do know that when they're well looked after, they will look after their family and they will look after the community. So overall, we have very interactive sections, powerful, high quality abstract presentations, have up to 30 speakers that are very seasoned. So I'm so excited that this conference is not just going to be any other conference. It's going to be a conference with a transformational impact. And that's what we're out for this October in Croydon. Thank you.
Thank you, Chris. So, I mean, my people, and I don't hear, so support for trainees. We're going to have people, health policymakers from Nigeria, but also our regulators here, the GMC, the various colleges, all coming together to discuss how we can improve and empower Mansag and empower the Black community. And there's also pastoral care, which is sort of what Chris was alluding to there. So please register and make sure that you get your friends to register. And if you've got trainees or people who you work with, please bring them along and make sure that you get your ticket on time. There will be a link down at the bottom. So we might be able to take one more question, Chris, if that's okay.
Yeah.
So somebody might be listening to this and they're not a member of Mansag, or maybe they haven't even heard much about, Mansag. I am wondering, there's a lot we can say about Mansag, but I just really want us to focus on just one or possibly maybe two key points about Mansag that you want these people to know. So I'll let you maybe just comment on that. Just really just 1 minute, because it's important that we try and keep this short.
Okay, thank you very much. So the Mansag as an association, we cater for all the healthcare professionals of Nigerian descent, and one of the things, both for at medical student level, nursing students, and other allied healthcare professionals, doctors, depending on your grade, junior doctors, trainees, consultants, GPs. And one of the things that we do is actually ensuring that we create a networking event that is pair nationally and also within the diaspora, offering mentorship and coaching from a vast area of senior clinicians. And also we do run induction workshops and seminars for our new international medical graduates, those who are just coming into the country, both the medical doctors and other healthcare professionals. And most recently, we are looking more into Leadership Academy, building our members at a younger age to start thinking about leadership. So we've started running a Leadership Academy, and this is geared towards empowering our members to start thinking about taking up leadership roles at their early stage in their career. Yeah. We also do different kind of revision courses for PLAB exams, membership revision exams, and we do offer travel fellowships every year for at least for our members that have done a fantastic work that they need to present either at a conference or they want to use it to do a specific work. We do that every year, so you can look out for that, and is entitled for every member can apply for that travel grant, and it is done every year, at least every March of the year. We advertise for that. So if you avail yourself of that opportunity. And finally, one other thing that we are looking at now in Mansag is actually getting more involved in research. Yeah. So we have what we call research equity, and I'm glad that we have the director of the University of Oxford Research Equity Center, which is a newly launched center that Mansag has as part of that. And what we are looking at is seeing how we can empower our members to be investigators so that we can actually be involved in this research that's being carried around. Yeah. So once we get involved, we'll be able to participate, because the narrative has always been that we don't have enough black population to participate in any study. And what we are getting is actually a study that is is disadvantage to us because we are not well represented in those studies. So we are looking at actually seeing how we can empower our members. Even if you are not a member and you want to get involved in research, we're looking at how we can actually get ourselves equipped so that we can be investigators in those studies and get our people to participate so we're able to change the description of how disease entities are managed in the community, and that will actually help us in improving our health outcome. So that's one of the areas that are very, very particular in this conference. And I was hoping that as an association, we're going to be driving more emphasis in how to get more people involved in research and see how we can leverage on the research equity that is being launched now. So I think for us, the benefits as a Mansag member, my personal experience, I've joined Mansag since I was a registrar, and I can tell you that I've benefited so immensely. Where I am today is largely part of the fact that I had some mentoring program. I have people that were my mentors and are still my mentor even at this stage. I can always run to, and that has really helped me in advancing very well in my career in the UK. And I can encourage each and every one of you. You might have a challenge with the regulatory bodies, with your trust, with disciplinary action. We are there to support whatever the situation is. We have a very robust system to support our members. So don't feel left alone. Make sure that you get yourself and get in touch with us. Even if you're not a member and you're facing any issues with your workplace or with GMC or any regulatory body, please don't wait until it is too late. Get in touch with us as quickly as possible so that we see how we can help you and support you throughout that challenge. Thank you very much. And I so very much look forward to seeing each and every one of you at this conference. I believe you me, is not a conference that you will miss. We have powerful guest speakers. We have Professor Dame Elizabeth Anion that will be our chief guest of honor, and a host of so many other people. Please, last minute, because the spaces are running quite fast, especially the gala night. We're going to be celebrating some of our members that have done fantastic work through an award ceremony. Please make sure you get your ticket. Don't wait until the last minute because there might not be space. Thank you very much. And I look forward to seeing you in October in Croydon. And expectantly excited to a transformational event. Thank you.
Well, thank you so much, Chris. I know, we can carry on talking about this for a while, but you see, every good thing has to come to an end. So please, our listeners, if you haven't bought your ticket, please try and get one. So there will be a link at the end of this on Eventbrite where you can register. So once again, the event is holding at Croydon the 27th and 28th of this month. So I hope to see you all. And once again, Chris, thanks so much for the opportunity to have this conversation.
Thank you very much for the great work you're doing.
Thank you.
Have a good evening. Thank you.
Thank you. And see you soon at the conference. Thank you.
See you. Thank you, everyone. Bye.
Thank you.
Bye.